So welcome dear friends. This is a small presentation I have made about the healthcare system in India. Especially I will be discussing whether the healthcare would be affordable by Indians via the insurance mode. So I am trying to raise certain questions based on the publicly available data. If I start the discussion by identifying who is the Aam Aadmi, about 130 crores is the population of India, and a better parameter of identify who is the Aam Aadmi is to stick to the government figures of Food Security Act. So Food Security Act is the act which provides the basic necessity, namely the food, to the most vulnerable sections of the population. So as per the Food Security Act, about 70% of the people are vulnerable, okay, and they should be covered under the Food Security Act. So of which 75% would come from rural and 50% would come from urban families. So taking this as a number, we can fairly estimate that of the 130 crores, about 100 crores are the people who should be covered in some way by the Food Security Act. Means according to the government of India, they are the people who are vulnerable. They might face some problems even for having reasonable food intake. So this 100 crores could be one figure which we can stick to for identifying the Aam Aadmi. You know that post-liberalization there are a lot of figures given by the government of India saying that the poverty of India has reduced by so and so percent. So we will not go into that discussion. We would say that 100 crores are Aam Aadmi. Other way of checking this is to looking at the income tax returns. So I'm assuming that all those who file the income tax returns, they are salaried people. They have a reasonable income. So that number comes to, if you count, if I consider 5 people per family, okay, that number comes to around 25 crores. So about 18% of the people come from the family which files the income tax returns. The people staying in the slums is about 10 crores. This is as per the national health profile. So one can reasonably say that of the 130 crores, about 100 crores are Aam Aadmi. So for this Aam Aadmi, what is the government doing? So according to the figures which are published by the government of India in the national health policy, India spends about 1% to 1.5% of its GDP on the public health. Now this is an extremely low figure as compared to the world average, which is about 6%. If you look at the spending by the developed world, the capitalist world, so even the United States of America, it spends around 8% of its GDP on the public health. The remaining 8% comes from the private sector. So how does this translate into? So the amount which is allocated for the health sector, mostly it goes to strengthen the national health mission. So this national health mission is a good activity actually, which has been designed to strengthen the health infrastructure, especially in the rural areas. So about 50% of that funds goes to the national health mission. Some 15% goes to strengthen the institutions like AIIMS and all other institutions, and about 4% it goes to fund the health insurance. So I come to the insurance because that is point of our discussion. Now this low spending, because 1% to 1.5% is extremely low spending, and this is not for a single year. It has been over the years, and not only the present government, but all the governments, irrespective of the parties, they have spent very low on the public health. So this means that this low spending over the years has strengthened the private healthcare institutions for not only the tertiary care but also primary, secondary, and tertiary care. And this has resulted in the public spending money on the healthcare. So if you look at the data, national, international level data, you'll find that it is actually less amount of money spent out of the pocket. The term is called as out of the pocket expenses. So about 70% of the out of the pocket expenses are by the people, and it means 30% is met by the government via taxpayers' money. So this especially is important to understand, because if there is so much of Aam Aadmi in India, and if they are spending 70% on healthcare, of which 30% is taken care by the government, it means that they become more and more vulnerable, especially in when they are facing very critical health related issues. If you look at how much this out of the pocket expenses, where this money goes. So mostly because the pharma, it is all the pharma related, pharma driven healthcare system now. You all agree with this. The money which is spent by the consumers, that is the Aam Aadmi, that 50% of it is spent on purchasing medicines, okay, prescribed by the doctors. And you know the present pharma driven healthcare system. So about 50% goes in procuring the medicines, and about 10% goes into diagnostics. So if you imagine that if the pharma is national pharma, and if the diagnostics facilities are available nationally by using public money, this expenditure of 60%, okay, this can be drastically reduced. But this is possible only if we go for social healthcare and not by private healthcare systems. So this distribution itself shows that the households, okay, they are suffering a lot by spending a lot of money on medicines, and not simply on hospitalization, because hospitalization cost is relatively less. It is on the medicines part, which is and which has a lot of a larger margin. Anybody who is from the pharma sector will tell you the margins which are there associated with the sales of medicines. Okay, so if it is made a non-profit activity, there could be a drastic reduction in the expenditure of the households. One data is very interesting, that because of the catastrophic healthcare, means suppose a family has some high spending healthcare issues, then that family is generally pushed below poverty line. So that about 7% according to the economists is that number, which is significantly high. Now what is being done is, instead of strengthening the public sector and instead of allotting more and more money, we are now started talking about the insurance model of healthcare. So that is the point of discussion which I'm going to have in this presentation. This is a small history of how the insurance model has been introduced into India, especially by nationalization of the private insurance companies in 1972. We had a general insurance company. So the major dominance was the insurance financed by the state, which introduced the Mediclaim policy and other policies, obviously, in general insurance sector. In order to cater to some needs of the poor, the government launched what is called as a Rashtriya Swasthya Bima Yojana. So this is where now the intervention starts, okay, via insurance. So earlier it was simply that we had government hospitals and low-cost pharmacy to take care of the grievances of the health grievances of the poor. But with this model now, you see that there is a Rashtriya Swasthya Bima Yojana now, where the poor can now buy the healthcare from the market, and because they are poor, the premium is paid by the government. So this was a model which was started in 2008. Actually, it started a bit earlier in 2003, but that was very significantly low level. Now, if you look at the data, now what is the present share? If you look at this this bar, so in 13-14, you see that this is a very dismal kind of thing. About 76% of the people or the population is not covered under any insulation, any insurance. So about 80%, you can say, is not covered under insurance. And it is the government which is actually providing insurance via certain health schemes. So it could be an employee state insurance scheme, which is 6%, which could be it could be a small part a central government health scheme or other government sponsored schemes. So that is and a very small role for the private sector, which is about 5%. And this has not changed a lot. It is slightly more for the private sector in 1670. So what you see is that the significantly large population, okay, significantly large population of the Aam Aadmi is uncovered by any health insurance. Now, one can think of increasing the health insurance. So, what I'm going to discuss is whether it is feasible to increase the health insurance, and you see, and is it possible to have the 100% of the population uh, being covered by the health insurance, which is financed by the state, that is by the government. Is it possible to have that kind of model? That is what I'm going to discuss in the next few slides. So this is what I already discussed, that these are the figures that of the population of 130 crores, the aim was to cover 22% of the total population. Not a very ambitious aim, and that was the smaller aim, but you know that this has been revised to bring a larger chunk of the population under the insurance cover. The state level analysis, if you see that why this is model is not going for the universal coverage, the state level analysis for 2012-15 with the popular scheme called as Mahatma Phule Jan Arogya Yojana, which is the state-led insurance model, you see that about 2 crore families, okay, if you look at the yellow card or the saffron card or the Antyodaya card, ration cards I mean to say, there are 2 crore families which are eligible, okay, to enroll in the Mahatma Phule Jan Arogya Yojana, okay, which would be obviously the premium would be paid by the government. But if you look at the actually enrolled figure, so about 7 lakh families, so about 3% of them were enrolled, and the premium which the government paid, okay, to this insurance companies for covering the small families, okay, small population, it was about 2,300 crores, okay, and the claims which were settled ultimately was around 1,800 crores. It means that some money has also gone to the insurance companies, to the TPs also, and how much by spending so much of the money, how much have we achieved? So we have achieved covering only 7 lakh families of the 207 lakh families. So all these 207 lakh families of Maharashtra are vulnerable. Okay, I'm assuming that all those with the ration cards are vulnerable, and 7 lakh families being covered at the cost of 2,000 crores. Now, where has this 2,000 crores gone? Where are this 1,800 or 2,000 crores gone? So, this 2,000 crores have gone in strengthening the hospitals, the private hospitals, okay, as well as the private pharma industry, and this money, which otherwise would have been used for strengthening the public sector and covered a wider population, okay, has been spent non-judiciously. So this we need to try, and this I will be focusing again and again, that this insurance model, we are using the public money to finance the private hospitals. Now look at this very popular scheme of Ayushman Bharat. Okay, this is a very recent data I had taken. This Ayushman Bharat allocation, you see, is around 69,000 crores. Okay, and of the 69,000 crores, you see, it's allocated, it's not yet spent. Okay, but let's say that government of India spends so much of the amount. Of this 69,000 crores, 10% is meant for the insurance model. Okay, so 10%, that is 6,000 crores, is meant for Jan Arogya Yojana, right? And the aim is to cover 10 crores family, 10 crore families. Okay, it's not again an ambitious goal, because you know that about 130 crores is the population and 100 crores is the vulnerable section. And of these 100 crores, they are aiming for 10%, okay, of the vulnerables, that is 10 crore families, each being offered a 5 lakh dose. So I just done some calculations. So assuming that 1% of the families, of these families, 10 crore families, they claim that 5 lakhs amount, okay, because of some disaster in their families, okay. So that would mean that they would be spending 50,000 crores. They would miss the compensation which has to be paid to the insurance company would be then 50,000 crores. So the government is allocating of 6,000 crores, assuming that only 1% families, okay, they claim, they go for compensation, and that compensation is paid. About 50,000 crores would be required. Okay, what it means is that if you talk about numbers, okay, vague numbers, 69,000 crores, 6,000 crores, and if you don't look at the details, we might be misleading ourselves in believing that about 10 crore families are being covered. Okay, so what the government does is actually the government simply shows off, saying that we are covering 10 crores, and a simple back of the envelope calculations show that it is not possible to cover the population, which is 130 crores, of which 100 crores is vulnerable, by allocating peanuts, okay, 6,000 crores of the money. Okay, so this we need to understand very clearly, that this whole talk of Ayushman Bharat, where they are allocating 6,000 crores, is not going to cover even 10% of the population. Okay. Instead, if that money, whatever money is being allocated, that is spent for strengthening the infrastructure of the public hospitals, okay, in the states, okay, and low cost healthcare options, that would be wisely spent money. So the critique of the healthcare model is, and there are other critics also, that the coverage is low, as I had proved. The public money strengthens the private hospitals. So of the 476 accredited hospitals, 400 are private. So the insurance money is ultimately going to be used for strengthening the private hospitals. There is no incentive to reduce the cost of the healthcare. So the accredited hospitals would not aim for reducing the cost of the healthcare, because anyway they will be funded by the state. Okay, and it is also seen that the companies would exclude high risk patients, which is generally seen that if you develop some health related issues, okay, then that high risk patient is excluded by the company, or his health cover is not increased. So this is generally the problem with the insurance model, that high risk patients are not favored by the companies. In fact, these are the people who are actually more prone to illness. And there is an interesting term called as cream skimming, okay, wherein high profit diseases are favored. So the companies, because they are going to get a package now, the hospitals are going to get a package, so they would prefer to treat the patients which have high profits in quotes. Okay. Now, why has this come? So this has come from the American private insurance model. So I'll just have a quick look at what is this American private health insurance model. In the American private health insurance model, okay, and this is not the figure which is quoted by some layperson. This is quoted by Bernie Sanders, okay, a socialist leaning Democrat, okay, and he has written an article in the Guardian on 2nd May. So you can refer to that article, where he is saying that America is spending about 17% of its GDP on healthcare, okay, of which 8% is subsidized by the government. So 17% GDP of America, you see, and talking about 17% of its GDP being spent on healthcare, and still 26% of the population is uninsured or underinsured. So look at this. America spending 17% of its GDP on healthcare, and 26% of the population is uninsured or underinsured. Okay, about 2.5 lakh families becoming bankrupt. So even a developed nation like America, using the insurance model of healthcare, is not able to cater to the needs of the armed Americans. Okay, armed Americans. Now, can we copy the American model? So, as I said, India spends about 1 to 2% of its GDP on public health. About 30% of the health expenditure is financed by government. Okay, so in the American model, the cost of the healthcare has increased to about 20% of the GDP, and 50% of this comes from the government, and it leaves 25% population underinsured. So if we are to follow the insurance model, then India would have to spend about 8 to 10% of its GDP on healthcare, and it would not be, even by spending 8 to 10% of its GDP on healthcare, it won't be able to cater to the needs of the Indian population. I mean to say it would cater to some of the population, okay, but not the Aam Aadmi which I had defined in the first slide. Okay, and this we know that the American model is especially adversely affecting the blacks, okay, of the America. And in India, if India follows this model, obviously as we are looking at the COVID impacts, we'll see that the communities which stay in slums, including the scheduled castes, scheduled tribes or Muslims, they would be most adversely affected. There are other health insurance models what is being proposed by Bernie Sanders for America, where he is saying that there should be no private insurance, or what is also seen in Canada, where there is again no private insurance. Okay. If you look at those models, you find that the poor and the rich, okay, poor and the rich, both of them would be getting the health services from the private sector, without having to worry about the premiums. Okay, actually, this is the model which the government of India is trying to implement via Ayushman Bharat. But as I had shown you, that this Ayushman Bharat, okay, is not a national health insurance model because it is using a targeting approach. It is targeting 40% of the population, and for targeting 40% of the population, it is not even allocating the required premium, okay, for doing that. So it is misleading. So though in Canada, theoretically, we have a publicly funded private healthcare. So it's actually a non-profit private care system. Or what Bernie Sanders is proposing is a Medicare for all system, where the poor would be taken care of. Ayushman Bharat is not even that. It's not even a national health insurance model. This we need to be very clear about. Okay, so we need to look beyond the insurance model if you want to really care for the poor. So one model is, and I will do a different presentation for this in detail if possible. One model is the National Health System model of UK, which was called as a socialist model by the Labour Health Minister of British Labour government when it was launched in 1948. It remains, see, from 1948 to this date, it has remained popular. Okay, vast improvements in the model has happened, and if the government of India is really serious about implementing the health for all promise, then it can do a lot of learning, okay, from this national health system model. Okay. But there has to be a political will. Similarly, the other socialist country, Cuba, it has got a low cost. It has got a low cost health model, and this also needs to be studied in detail, because both these models, the UK model as well as Cuba model, is not an insurance model. They are the models which are based on strengthening the public institutions, not for profit institutions. Okay, and this could be the right approach in my opinion, because the problem with the insurance model is that it strengthens the private sector, number one. It has the targeting errors, number two, and number three is that it is a model which requires lot of investments, lot of money, and there is no political will to spend money because of the classroom. Okay, so if you want to go and achieve health for all kind of thing, this is the agenda before you. As an individuals, we need to see that all the poor, they are enrolled in state insurance schemes. This is a short-term agenda. Okay, but in the long term, we need to see that the parties, okay, which are advocating socialist healthcare, they come to power, they win the elections. Okay, and you know who the parties are. Thank you very much.